Suzanne, I want to touch on this. You worked for quite a few years at a very esteemed hospital right here in Atlanta called Emory.
Yes.
And you had an amazing reputation, and yet here you are practicing more functional and integrative medicine. What prompted you to look at your life and to make that shift?
I was practicing, probably seeing 30 or 35 patients a day.
Right.
And I kept seeing patients who were sick, but all their labs looked normal. And it was difficult to know what to do with these patients, because I knew as a person, as a human being, I knew that they were sick, but I couldn't figure out what was wrong. I couldn't find with Western or allopathic, we call allopathic medicine, I couldn't figure out what was going on with them that might be the reason why they were feeling badly, because everything that I was taught in school and all didn't really give me, not to mention, I didn't really have the time. And so when I think about comparing myself to an allopathic doctor, my heart breaks for them a little bit, because they really just don't, 7 to 10 minutes for every office visit.
Right.
There's no way.
Yeah, you can get at the core, the root cause of what's going on.
I have a new nurse practitioner who works in my office, and she has patients from her old office who came to us from her old office. And she said, "You aren't going to believe this, Dr. Turner. This old patient who came to me just completely opened up and shared all this information to me this past week in our visit." And I said, "That's because you have the time to spend with her."
Right.
Because we make a priority of actually listening to patients, and listening is a big part of our training. And it's not that that allopaths can't listen. It's just that they don't have the time. It's just
I get it.
The system
it's very, very expensive to run a hospital, for example.
It is.